In this video, we're going to be talking about Mike Majlak going on TRT, which is testosterone replacement therapy, and what his thoughts and the benefits for him that he has seen. If you're new here, my name's Dr. Adam Nessum. I'm a physician interested in performance and sports medicine, and TRT is definitely a hot topic these days. A lot of people that are high-level executives, you see it a lot in the influencer sphere as well now, that are, as they're getting older, they want to optimize their hormones, are going on TRT. There's some conflicting research on when exactly this should be prescribed. Generally, it used to be only if you had very low testosterone. Now, getting your testosterone checked and when you do it and how you do it is actually important. There's TRT clinics that are able to kind of manipulate the facts of whether or not someone's actually low T. For example, you should be doing it in the morning. You don't want to have done it after crash dieting and things like that. Otherwise, your testosterone is inevitably going to be low, and then you could get that prescription. But there are a lot of benefits, and I think as medicine becomes more personalized to the individual, you're going to see more and more people getting these different types of prescriptions to allow them to optimize performance. I definitely think as you age, and we know that naturally your testosterone levels decline, there can be benefits to getting on TRT, but the reference range, as with every medication, there's risks, there's benefits, and as long as you're making the most informed decision for yourself, that's what matters. And so let's hear what Mike has to say about getting on TRT.
But can I ask you about the testosterone?
Sure.
So that's something that I have been looking into, but I have not ever done.
Sure.
So once you start that,
it's
for life, right?
It can be for
now,
sure.
Are you using a needle in the butt?
Yeah.
Okay.
Yeah, it can be. And by the way, like, take it from me, there's nothing that scares me personally, obviously, than entering into any program that could potentially have that type of longevity. I do not take any chances there, right?
Sure.
And so you really...
So historically, the reason you would take testosterone replacement therapy is because your testosterone is very low. And so ideally, when someone goes on testosterone and needs that replacement therapy, they're going to be on it for life. Additionally, even if you don't need testosterone and you start to take very high doses, and this is what happens with people that take anabolic steroids, not just talking about TRT, but what happens is you suppress your HPA axis, and what that does is results in a downstream effect where you tell your testes to essentially stop making testosterone because you're getting it from an exogenous source. And so when you come off, if you ever try to come off of the TRT, or if you're using anabolic steroids or something like that, there may be a delay with your body being able to start to make that testosterone on its own again. And sometimes it's actually difficult, and maybe your body cannot even ever start creating that again. That's why you see bodybuilders and people, when they come off what they call a cycle, they're going to sometimes use certain molecules like clomiphene, which will help signal to your body to start producing that testosterone again. Now, most people, for example, like Mike, if he just started TRT within the last few years and he goes on some sort of PCT and stops the testosterone, his body will probably naturally be able to start creating it again. But there's definitely going to be a lag where he's not feeling as well. He's not having that same high level sustained testosterone that he's used to. And so the goal is, if you're going to go on TRT, there shouldn't really be a reason to come off unless you're experiencing bad side effects or other reasons that it's impacting your health.
And so you really do have to weigh it out. If you are first and foremost, once again, talk to your doctor. But the way I look at it is, if you're in your 20s,
you're not going to need it.
Unless you are extremely low T, and those people do exist.
Yep.
Yeah.
There are low T individuals out there that are so the range for testosterone is from, I think, around 300, it might be 270 up to,
1,200.
Yeah, and like the 1,200,
14,
1150, 1,200 range.
Yeah, and each place has a little bit different numbers, but it's somewhere.
That's like the kind of range.
Yeah, if you're
they use.
900, you're
Yeah, that's actually correct information. So every lab might have a slightly different, or even hospital system, depending on the EHRs you use, they're going to have these ranges of what's considered normal, and they're not always exactly standard. It usually is from around 300 to about 1,000. That's going to be within the normal range. Now, here's the thing with with testosterone. There's the amount of total testosterone, but there's also the amount of free testosterone that you have. So someone might have a total testosterone of, let's say, 600, but they don't actually have as much free testosterone as someone who has a total testosterone of 400 because that person has less bound testosterone. Also, everybody's different in how they respond to testosterone. So you could have someone that, it looks like they have low testosterone. They only have 400 to 500, not 800 or 900, but they respond very well. They're a hyper responder to testosterone. They don't need any more. They're big, they're jacked, they're healthy, they're functioning well. That person does not necessarily need to go on TRT just because even if they're in like the 300 or 400s. You could also have someone that has a higher testosterone, maybe 500 or 600, 700, and they have a very low free testosterone, or they just don't respond as well, and that might require further looking into.
You're doing great.
You're chilling. No,
Yeah,
you're chilling. I mean,
great.
dude, honestly, if you're in your 20s, even and like my assumption would be is even if you're in your high 6s, low 7s, you're chilling.
Yep.
But if you're 22 years old and you're coming in at 350 on a testosterone exam, you might want to consider it because there's a detriment to your health.
We have to have
And
it.
your hormones control your brain.
Correct. 100%. So much is
Okay, so there is some truth to this. However, I would caution of a lot of young 22-year-olds, even young 30-year-olds that are in the bodybuilding scene that have low testosterone that take one test and then jump on TRT. The reason being is, one, when you take that test, you get your testosterone, that's only one snapshot in time. You could wake up the next day and get your testosterone checked and it's 100 points higher. It, again, depends on how your sleep was, what time you actually got the testosterone drawn. It should generally be drawn in the morning. Have you just come off of a crash diet? If that's the case, your testosterone is going to be much lower. So what you'll see actually in some of these TRT clinics is, you have this bodybuilder who just was performing on stage, so they just went through this hard diet, they weren't getting good sleep, their testosterone is going to look very low. If you go based off that one number, of course you can think of a way to then use that as a justification to prescribe them TRT, but that's really not what's in their best interest. Realistically, you should have multiple points in time where you're getting your testosterone checked, and you should also try to do it after good sleep, good diet, and all these factors that are going to affect what your testosterone levels are showing. If at that point you still have low testosterone, then it may be worth looking into why is that the case. And you have to look at other factors, not just your testosterone, right? Your total testosterone, your SPG, your free T, your LH, your FSH, and you really need to look at this from a very broad lens, and it should be done with an expert in this field before making a decision, a lifelong decision like Mike describes, to go on testosterone.
Is driven by hormones. So, yes, it was something that I really had to think through. But at 38, well, I guess I started when I was 37.
Okay.
Looking around at my complementaries and competitors and people that I knew in the space that were also utilizing, I mean, dude, like Joe Rogan's obviously a huge proponent of it. And I'm not saying to take all of his medical advice, but like there's a lot of wealthy people.
It's just facts for men need testosterone.
Correct. It's important to us. I started on a moderate dose, but then found that I was doing very well with a very low dose. Okay. So I do
twice a week.
I'm twice a week. Some people say some people do every day through thigh as opposed to the butt, and you can do it painlessly to yourself if you want. I've been doing just fine with twice a week. Once a week, not as well because you do start to trough.
Yep.
And so I do twice a week, Tuesday, Friday. I do one before the weekend. I'll do a leg day on Friday along with it, really get a testosterone boost for the weekend. But for the most part, I am extremely low. So I do about 0.4, 0.5 per week. And I don't know how to describe that.
I think that's good. So if you are going to go on TRT, you should be going at the minimal effective dose. You don't want to take any more than you need to feel your best. And so I like how Mike does it. Also, in the past, people would inject like once a week or once every other week. There's now good research showing that you want to try and reduce the amount you're getting each time and increase the frequency so you don't have these big peaks and troughs in regards to your testosterone that you're getting. And so it sounds like he's on a good regimen that works for him. And so again, if you're well informed on the risks, the benefits, that's the most important part. Just being informed as a decision maker, as the patient. I feel like a lot of people that jump on these things are just not well informed. I have no problems with you doing with your body what you want to be doing. Again, it's all about education though.
and like a term of like what that dosage actually is. People who know testosterone will know what that means.
Did you notice noticeably different?
Extremely.
Yeah. I have a couple friends on it. They look and put off a whole new vibe.
Yep.
I mean, they just look great. They look like they feel great. And it's something I've been heavily considering.
I think
I would just need to order. I would need to have about a 6-month supply at my house in case something goes wrong with the world and now I can't get my testosterone and I need my backup and I'm not crashing and like.
So what I'll say is this, dude, like you'll like reset. It's not like you don't die. Like
but you crash hard, right?
Depending on your dose. So if you're like taking like a major dose or a dose that substantially affects your test, then yes, if you were to cold turkey, you would have some sort of reaction to that. Whereas you would you would return to your resting state, but that return would be so abrupt that it would feel not great, right? But the idea that would happen, we would end up in a place where you wouldn't be able to have access to it to such a common thing nowadays would mean the world has ended anyways. And so like, in all honesty, like, bro, like
you also might not just be right away at your resting state or your baseline. You would actually potentially be in an even lower T state because you're not producing as much LH and FSH to signal to your testes to produce the testosterone. So that's why, again, there's these medications that you could take if you're trying to come off of something like TRT or anabolic steroids to help essentially kickstart your system to get you going. But yeah, if you are on testosterone and you're feeling good and you abruptly come off it, you will probably feel lousy for a little bit.
You're going to be worried about is like your test rate at that point because you're going to be fighting with an AR-15 for your kids and shit. Like,
but I won't be able to fight without my needles, bro.
Yeah, maybe.
You get them, babe.
Yeah.
Get them, babe.
Your test is higher.
I just think of like all the supply train. All the trains they derail at the same time.
Yeah.
All my test is on there.
Yeah.
Yeah.
Yeah, you can get it pretty easy. And I think like as long as you had like a full bottle on the side, what you would do is you would just start to wean off.
A little bit at a time.
Yeah.
All right, so we'll end it there. I think Mike seems actually pretty well educated, which is good. You should be very well educated before you go on something like TRT. I thought it was fun just to see. I could tell that Mike's getting in much better shape. So again, these are things to consider too before just going on TRT. You're not going to just take testosterone and all of a sudden you're going to get a six-pack. You need to be eating well, working out. So you should be sleeping well. Good sleep hygiene is very important. You should be doing these things before going to exogenous supplementation. But if it's something that you feel will benefit your life and you do have low testosterone, then it could have, as you could tell, Mike said it has been very good for him and he feels mentally sharp and it's good for his physical conditioning. So there are definitely benefits. If you want a more fully comprehensive video breakdown of, the benefits and the drawbacks of TRT, maybe we could do a deep dive into that. If you're interested, let me know in the comments below. Just thought this was an interesting little clip to respond to. Hope you enjoyed. Please subscribe. It would really mean the world to me. I'm really trying to push out more YouTube content this year, and I'll see you in the next video.